Alrighty. So I can give you a link of a small movie about positive health for the people who didn't hear about it yet. But it's a concept which helps to make the transition, as I said, from more disease care to health-oriented care. And yeah, I'm a general practitioner from the Netherlands, and I'm really brought up, like many other doctors, about learning about diseases, and which is of course very important. But of course, a lot of things changed in the world over the last decades, and I think we need also other things. And we also have a lot of pressure on our care system. This is the pyramids from the Dutch situation, and this is presented once by a colleague from the insurance company. This is not a reality, but this is about an idea to show you that from the 100 billion euros spent in the Netherlands about healthcare, about 97% is spent on the blue parts on the left side of the pyramid, which is mental care, hospital care, long-term care, integrated first line, and only a small part, 3%, is spent on prevention. And what we see is with the increasing, chronic diseases, with increasing aging, with increasing pressure on capacity and costs of our care professionals, we see that things need to be changed. So ideally, this broad, the pink base of the pyramid should be transformed or shifted, and we need a broader base of prevention, self-management, empowerment of citizens, taking care of each other, using digital e-health, etc. Of course, there is a lot of care still needed, integrated first line primary care and also hospital care. But this is expensive care, which is the question if that's always needed as it's provided nowadays. And I realize that this is not, that a lot of specialists, if I show this picture, they say, well, so small, that's never possible in hospital. But this is an idea of the shift we want to make. And this is one picture where people did become healthy, did become old or aged without any mental retardation or chronic diseases, the blue zones. And it's interesting if you keep this in mind, what you need for healthy societies, for healthy communities, because in these places, not only moving naturally and eating healthy is important, but mostly the social component. So this community feeling, this belonging to a tribe, belonging to other people, looking after each other. That's really an important theme in becoming healthy, in healthy aging. And also meaningfulness is really important. So people standing up with an ideal. And these two elements, this participation and meaningfulness, is important in positive health. Well, I'm not going to explain you again, that's in the previous session, and you can look at the video about the whole research, what brought, how positive health has been developed. But the start was with the meeting 10 years ago about health as the ability to, where a lot of international professionals came together and they said we maybe need something else than the definition of health as it is now in 1948. And then they came up with a general concept: health is the ability to adapt and to self-manage in the face of social, physical and emotional challenges. And this has been elaborated in the Netherlands with research, and it finally came up with the concept of positive health. The positive health nowadays in the Netherlands has been, I think, like 5 to 10 years, we have been developing and working with it on different areas. And of course, it goes step by step. But now it's in the national health policy, it's in a lot of regional policies, and step by step also more and more professionals starting to work with it. And the interesting part is, and that's also in the case of thinking about community care, is that if you look what someone needs to be healthy, you have these 6 dimensions, which we come back, which are in the positive health concept, this is like the bodily functions, mental well-being, meaningfulness, quality of life, participation, and daily functioning, as you see the umbrella. And if you find out within an alternative conversation with a patient or a client or a citizen, what is important to someone and what they need, then you can find out what someone can do by themselves and also what they need from the care. So maybe if a lot of things go on in people's life, you need cooperation around citizens, but also if there's a lot of underlying problems for people having diseases or having problems with their health, it's important to be aware and to see what they need before starting to talk about, well, only the diseases. So it's good to see the whole perspective, what's needed in someone's life, and also how you organize care. And this is the, so for the people who don't know what positive health yet is, this is the Spiderweb where we work with these 6 dimensions, the bodily functions, the mental well-being, the meaningfulness, quality of life, participation, and daily functioning. And you help someone to become aware of how do you feel today, or this week, and what aspects and which dimensions are at this moment important for you. Is there anything you would like to change, or is there anything you want to give more attention? And what is a small step you can take towards that wish of change? And what is it what you need to be able to do this? And I'll the previous time I gave a few examples with my patients how I use this. I'll do this later, or maybe when we don't have the slides in front of us, I can give you a few examples. But this is the tool, the Spiderweb, what positive health makes easy to use in a conversation. And this can be a doctor-patient conversation. This can be students among each other. This can be used at a lot of different places. And nowadays, we also start to have it in healthy fertility at work, or even schools start working with it. There's also a young version for children and young people. And we also have different versions. Let's see, we also have the German one here for our guests from the German-speaking countries. And I'll show you later where you can find these. But working with positive health is about 3 elements. So on one hand is this philosophy about broader looking at health. And the other hand, it's the Spiderweb, which you can use in this alternative conversation with the other. And the first step is that we actually, it's actually a reflection on your life. Like if you fill in the Spiderweb, the question is like, how do you feel? What do you see? And what is your wish for change? And what is it what you need? This different conversation about it, this makes you aware what you can do yourself, what you really would like to change. And then the third step is, can you come up with small actions for the person, him or herself? And this is how we use positive health in a one-on-one conversation. So, and then I'll add one, the next step, I'll come how you can use this in the community, but this I wanted to show briefly in a one-on-one conversation. And the power of this approach of positive health is that it includes the principles of this blue zones. It's about nutrition, movement, meaningfulness, social embeddedness, and it gives people overview of their life. It gives also grip on their lives, and it addresses the meaningfulness and the overall approach. Here is also in the slide explained about the sense of congruence. I didn't go into this into more depth, but if you want to know more about it, I can, as I said, there's more videos also I can give to you as links, and you can look it up later yourself. So all the lessons learned in the Netherlands so far, we published in the handbook. I was one of the co-authors together with the founder of Positive Health, Machteld Huber and Hans-Peter Jong. And there is first, the first part is mostly about the whole research, how we came up with positive health. And then we have 4 chapters of how this is applied into practice. And the lessons learned in the Netherlands, we would like to also pay it forward and see how internationally we can upscale this and see how this could be interesting for more and more people. So what we learned in the Netherlands were a few things. If you work with positive health, you want to start locally and you want to have you want to really connect with inhabitants and with health partners. So it's interesting to do this in a community and to work together on this same broad vision of health. The second lesson learned was there's always interconnection on different levels, and I'll show you in a picture later what I mean with the different levels. So it's not only having just one-on-one conversation in a practice, but it's also how do people within a practice or in a team work together from out of this broad vision of health. And it's also how do you work together in a community with positive health. And the third lesson learned was that you need funding to start, and it would be good if you have someone also who can organize this together. And of course, initially you can start with the Spiderweb, and a lot of if you have a few ambassadors who want to work with it, that's fine. But if you really want to bring it steps forward, people want to have training, and it's nice if we have in the Netherlands we had a lot of pilot projects, and now some of the insurance companies have funding of have it part of the care to have doctors, for instance, take training to get this applied, implemented in their daily work. The fourth lesson was other organizations want to connect. If the vision connects, so you want to have like a shared vision. So what we see many times, if we work together in the community, we have, for instance, people from the public health, from the care, from welfare, from sports, from inhabitant organizations, and if they all work from out of the same vision of positive health, that really connects together to have the same language of which we work. And then the next lesson learned was from the start, keep in mind how your program will be sustainable over time, so that you really don't just start and then at the end there's no money left, or people who are enthusiastic, they move and then the whole concept is gone. And it's nice to have a vision and goals in a collaboration in a community. And a few pictures, like I think positive health is really about being more proactive than reactive, and it's really personalized care. So one size does not fit all. And as a summary of the things I just had as lessons learned, this is what we use to explain about these different levels where you can use positive health, and also what the benefits are of using it. So on this citizen level, I just said you have this one-on-one conversation, and what we get back is that patients feel more heard, and the patients also, if the people get more at the place where they really need the care. And there's also more job satisfaction from the professionals. And on this team level, it's important, as I just said, to have this shared vision and to work together from out of this shared vision and to inspire each other. And then we deepen further into this local community. So it's really important that everybody speaks the same language, and positive health really helps as shared language. And it's nice if you work together to know each other and find each other. And on the regional, national level, it's important that this is, also, like as I just gave in the example in the Netherlands, that if this is in policies, that also it gets easier facilitated to work together on this field. So if we now start on this, how do you start with creating a healthy community? Because I'm not sure how this is in your areas, but I work as a primary care doctor, and there's so many different ways where you can send a patient, or where a patient can find support. And a lot of times I don't even know about what's all there. So you want continuity, you want cohesion, you want also some kind of coordination in a community that you can find out what's where. And if I explain you what we did in the Netherlands to start with working together with a lot of different community partners, is that we started again with this joint vision. Like, what is it, what we want and what we need to do for the people living in this community, and how can we do this together with the local community? And what we use to get to this joint vision is the data from, in this case, from our public health providers, to find out what are the problems in these areas. It of course depends if you're in an area where it's deprived or where there's a low socioeconomic status, then you have different problems to deal with than, for instance, in a community where there's all aging people, or in the community where I live is a newly built area where there's a lot of young people, a lot of psychiatry problems, a lot of new people, expats, etc. So everybody has their own, every community has their own challenges or inhabitants with certain background where you could focus on. It's also good to know that you don't do 1,000 different things at the same time, so that you create also focus and prioritize what's needed, and preferably based on what the needs are from the people themselves. So in the past, I realized that as professionals, we started coming up with all kinds of programs for the community, and now we really do it together. And that also helps to do this with positive health. It's also helpful if you want to create a healthy community, to develop a social map to find out where, as I just showed with the signs, different signs, that you can find where you can find health professionals in your neighborhood, and how this could be coordinated to find out where professionals in welfare, sports and health are available. And then finally, you can come up with either projects or organize network meetings and evaluate yearly in a cycle to keep and make this sustainable. This is what we did a few years ago in our area where I live in Utrecht. And this is in many areas where they really work together in a community collaboration network. And now I want to give you an example how positive health could be used to create this community care philosophy from out of positive health. Because if you think about these 6 dimensions framework, you can also think about these 6 dimensions in their life environment. So if you look at either street level or neighborhood level or even district level, it's interesting to be together with the people from these different levels where you want to find out what is available on these 6 dimensions in my neighborhood, in my community. And if you bring this one step further, this could be an example of how this could be entered. Like we have like sessions where people are with post-its, like filling in, like, oh, if I'm looking for mental support, and these are addresses we have in our community. And other people say, okay, if you want to look for physical bodily functions, then we have access, well, to medical care. We have walking and bicycling facilities, all kinds of things. So nutrition and exercise, that's then, for instance, the health side. But you also have the social side, like what is there around people on street level, family, friends, neighbors. What do you have further community level, volunteers, work, etc. And also the district, what is made available in the living environments of people, also supported by the public health. So this is just an example how this model of positive health also can be used in the community. And this helps because we all have the same language among the professionals. So it's interesting that it doesn't matter if you work in social care or health promotion or in the primary care. The hospital care is a little bit more difficult because these are still a lot more disease oriented. But it's interesting if you talk from out of health, and also if you really have this meaningfulness central, and also to support the citizen empowerment, to empower people to ask what is important for you, what is it what you need, and what is the step you can take, instead of having them to go to the doctor and say, can you please solve my problem? A few examples, and then we'll go into discussion and see how this resonates to you, and what kind of questions or ideas or needs you have, or how this is in your countries. So this is an example where on this on a level, actually, so they used, they also filled in this positive health 6 dimensions, and then they had a big building. I don't know. It's like where they had I don't know, it's kind of old fabric. And they had 25 different disciplines who rented the space where they had, of all these 6 dimensions, a place where they facilitated their care. So those were on one hand where there were primary care facilities, and there were like physiotherapists, psychologists, occupational therapists, midwives, etc. But also the whole mental care and the whole part for meaningfulness and the whole part for more social activities. So it's really, yeah, designed with this positive health concept in background, and they have meetings together with inhabitants in that building. This is an example, like in my neighborhood in the Netherlands, in Utrecht, Leidse Rijn, where we have, it's called In de Kern Gezond, and they have a positive health place for inhabitants with inhabitants. This means that all volunteers go there. They also get training to become a positive health volunteer, and then they have conversations with other inhabitants. And what I really like is that to have this in my neighborhood is that when I, in my practice, have this alternative conversation with positive health, and people want to do something on the area of meaningfulness or social activities, I refer them to this place in de Kern Gezond, which is like a house in our neighborhood. And there they continue the conversation on what's important and what kind of activities they can do. And this is like on every level as possible what they can create together. There's all kind of workshops they can do what they want. For instance, on healthy moving, on healthy food, on mental well-being. There's like all kind of courses. There's all kind of activities also from out of the sports with regards to living environment, meaningfulness, and social participation. And it's not that all these activities are already there. There's some activities are organized, but it's also that they say, okay, what is what you want to do? And then they do a lot of matching together. So they match people based on what they need. So instead of working from out of this medical curative model, we're more working toward networks, social interconnected networks. And it's really great to have like a network in the area of where you live, where you work, and create community care there. Maybe I'll just have a short break to see how this is resonating. So I'll just put the slides away, and then we can see if we continue later, because I have been talking too much already. So I'm just curious from all the people who are here, how does this resonate? What did you already know? What's new? And how would it be in your area? How could you use this information for your area? Maybe we can just do a round lane. How is this for you?
I don't know if did you say my name? I'm not sure. Okay.
Yeah, that's okay. You can start.
Okay.
Yeah.
Yeah. Now, as I said, what I said to you before, this is for me not that new. So it's but it still stays very interesting, and I'm happy that more and more professions will look with that holistic view. But maybe I firstly let the floor for the other people, and then afterwards I will give also some suggestions. Okay, your micro is not on, so we can't hear you.
Yeah, no, that's a good idea. We'll first ask the other people, and then because you're doing a lot of things in the community also, and you have maybe suggestions for us all to learn about. So that would be good. So Gasper, for you, this is all new. How does this resonate?
Well, it's as an occupational therapist, it isn't that new for me because it matches a lot of our occupational therapy philosophy, I think, because we are really in daily activities and meaningfulness and participation and all of these things. And so positive health as a word is kind of new, but the concept behind it isn't that new for me as an occupational therapist. And it also remembers me of social prescribing, because in the primary care setting where I work, we had a small project about social prescribing, and it was also about neighborhood, finding resources and how to assist our clients who are in the primary care, and less medical view, but more social, participational view, I think. Yeah, and so it really I like the thought of the holistic view, and it really touches me as an occupational therapist because there are so many resemblance, so many things where we can, okay, that isn't new, and we can work with it, and yeah.
Well, that's so nice to hear. I hear many times also in the Netherlands from occupational therapists, they say, well, of course, this is the way how we work. We look broad and we see what is important, etc. So that's nice to hear that it resonates. And what I hear back from my colleagues in the Netherlands who work with it, they say, okay, it's nice to have like the vision, the broad vision, the holistic view we already have, but that you also have a tool which can sometimes support in the conversation. And what I like is there's also a great video of a patient who had to rehabilitate after an accident, and then everybody said, "Oh, she's not motivated," and everybody was really looking from out of the disease and the professional side. And then when she finally, got connected with her wish, with her dream, she really it was so much easier to rehabilitate. Well, that's probably what you do already. And this is like more the broad vision. But then if you have this tool with the Spiderweb, it supports people also to reflect inside and have the process themselves and become aware and think, okay, how is it going with me, and what is important at this moment, just because this could change over time, of course. And that is mostly what I hear back from the professionals, that really supports, and also that you have really quick an overview of kind of a picture, like how is it going with someone, and then it's easier to go into next steps. So that helps for me also in the practice. But the social prescribing is definitely, it's also something we have in the Netherlands, which is many times the second step after this conversation. And many times we do social prescribing as well. And this is super that it's there. Yeah, you have a lot of experience in Austria with social prescribing, isn't it? There was also a lecture on this webinar series. Were you there as well?
We had last year a project about social prescribing, and the Fonds Gesundheit Österreich financed it, and so our primary healthcare center where I work was part of the project. So we already tried out and used some networks, and it was a very positive experience for us. Especially, it wasn't just me as an occupational therapist, but also a dietitian and a social worker, and so we worked together, and then we had the whole base of the holistic view, and so it was very, very nice.
Yeah, good to hear. You probably do a lot with nature as well, I think, in Austria, right? Because that's also something which is often gets more into the social prescribing.
It depends in what environment we are. So in a city, it isn't that easy, but we also tried it. Yes.
Yeah. Okay. Well, thanks for your reflections. How is this for you, Jasmine?
Hi. The concept is not so new to me. I have a very enthusiastic colleague who introduced the concept to me a few years ago. So I know the general broad vision of the positive health, and I've been trying to implement it in the research department as well. And that was the background that I'm here for. So I'm continuing on trying to learn new things about positive health and how to integrate it in research. And now I'm involved in an international research. So not only with the Belgians, but also with the Portuguese, people from Austria as well, Hungary, Romania, Latvia. And I notice especially that the concept is not so well known there. Austria, yes, Portugal also, but the more Eastern countries is not very familiar with the idea, and that's causes a bit of lack of information, and that's why I wanted to get some new inputs following this webinar and the previous one, to get some more inspiration on how to implement the concept of positive health in the research department, because I'm the only one familiar, really familiar, so to say, with the idea. So I'm actually the only one who can advocate for the concept. So I want to get my basis a little bit stronger.
And what is the research exact about? Because there's also a whole international group working in the education, but I'm not sure if that's the same, but also the same countries, I think, Portugal, Austria, but there's also Czech Republic. But tell me about what's your research? Yeah.
We have a project on itself in our university in UCLL in Belgium, that's called UDRES. And so it's a project in itself that wants to provide a basis for future universities and how those universities should look like for the students, for research, etc., etc. And we have to do research in rural areas, specific for those problems in the rural areas with citizen science. So really bottom up instead of top down. And that was the approach. And we can choose which research we do, but it has to be involving citizens, and it has to be with local needs, not the big theoretical needs. And I found an interesting call. We want to go for an horizon call, and that was the basis for this. So we want to come up with a tool or something, an instrument or concept to help the holistic support of adolescents. And we have the opportunity in all of our countries to work with the students. So actually they can be our target group. And I was thinking in involving the students, using the concept of positive health to get them involved in the community of the school, because they're small schools, so you can work with the community, or they can work in their own communities at home with their neighbors, with their family, with their parents, to broaden their perspective on health. So that was the idea, but we have to find a concept now to work further on. But I really want to stay in the lane, so to say, of the positive health. And I noticed that my colleagues go more towards a more classical vision of health, and that's what I want to prevent. So
I can connect you, Yasmin, with one of my colleagues who's very active internationally in this field of, first of all, get positive health and vitality in educational programs for the young people, for the young students. And I really like your idea also about your research of these rural areas, and then have the citizens.
Oh, your sound went away.
Just something, yeah. We also have projects in the Netherlands with citizen science that we really, go to the people in the community themselves, and then have conversation with them, what they need from out of this holistic perspective for their health. And it's interesting to see they come up with things, what they need, totally different than what if, policymakers think, well, there's an area and we're going to arrange this for them instead of the other.
Yes, indeed.
So this bottom up, collecting and really creating what the needs are. It's really interesting. It's interesting to see how this goes, but it's also difficult sometimes because you really need coordination and sometimes also funding to get this going. Because if everybody has to do this in their own time, besides their daily stuff, it's difficult to actually get it going. But it's great if you do this with this research project.
Yeah, because this would be a great way to start with the Horizon call to try to implement something, because I can't say that Belgium maybe is top of the lead of the positive health, because we still have big steps to take. But I think we have to find a common ground with all the countries if we are doing more projects involving positive health, and the other countries maybe still think of it as a new concept. Then we have to find a common ground that we can start all on the same ground. So that would be a nice way to go further. But it's still ongoing. So I was here with like a sponge, so to say, to take some new ideas with me. But I did.
And that's good to hear. Yeah, and it's also interesting. I'm at this moment also in a call because I'm the lead of the Institute Positive Health International, and I'm in a call about building resilient communities with positive health. Of building resilient communities, and my proposal was to do this with positive health. And I met a few people. I will hear in a few weeks if this call will be accepted or not. And then we also have some possibility to create in a few new places, new communities. So you never know how things come together,
Yes,
right?
indeed, indeed.
And also at your university, I think, I'm not sure, but we can on another point connect and exchange some names who are active in the doelgerichte zorg and kind of things in Belgium where they're working on also with positive health. Yeah, so it's interesting. It's really coalition of the willing. You see people get interested, start working with it, also enroll new people. Say, oh, this is interesting, and so it's a growing movement. And it would be nice to connect with each other to see how we can further have this growing. Yeah,
sure.
So I also see, thanks for sharing, Jasmine, it's very interesting. And I also see Regine, I don't see you camera, but did you hear our sharing? Did you want to say something? Or otherwise we go on to Lane. Maybe Lane, you can share first. Yeah.
Okay. No, I just I'm curious. Nice presentation, nice vision. First, I want to say that. I'm curious regarding, you have a nice map where you put in all the information. How do you collect this information? Who does what? And how do you disseminate it? Because we also have our, ethical privacy things. So I was wondering about that. That was one question. And a second, but of course the presentation was very short now, but I did not hear that much regarding health literacy. And I think this is something as occupational therapists, we also take into account. We work client-centered, but when you want to work client-centered, you must be sure that your client knows what he has to know so that he can make the right decision. So shared decision making is not only asking what he wants, but also informing that person. And this is another topic. And Klaus, I'm happy to hear that you're also an occupational therapist. Maybe we have to keep contact afterwards also. These were just two things. So one question and one suggestion. And then about the second suggestion, the motivational interviewing, I don't know if you talked about that, but that is something we also, as occupational therapists, used before, I think, motivational interviewing as term existed. What did I want to say about that? Oh yeah, we talk about the use of self as therapeutic tool. So we use our competences, and when I'm talking with the person and Klaus is talking with the same person, he will do it on another way, just because we are using our therapeutical competences and skills and our experience. So that's I hope, is it clear? I'm not sure if I was talking that structured, but
no, definitely clear. So first answer on your question, how do you keep the social map updated and how do you disseminate? This always is everywhere a struggle. We didn't found the total answer yet. Like our public health colleagues, they have a social map with the main themes on it. But in this, the picture I showed you of our community house which goes out from Positive Health, they create this social map with each other, also with an app where they connect people and match people with each other. So it's like, how do you say this? You can drop something on it if you imagine you want to. This is more between citizens and together. It's like, imagine you have a garden and you don't have time for gardening, and someone else likes gardening but they don't have a garden, and they connect them together. So these kind of small things already see, and everybody has his own apps to create this, but many times people just forget how close, how small sometimes the answers are. You need to have people connecting things which are important for them. And then with regards to yeah, we work with key figures. So per dimension, we have like a key figure who has, and then we provide like their contact details, and they know exactly what else is needed in the area. So for instance, for mental health or for sports, we have like 2 key figures, and we refer everybody to these 2 people, and they can explain exactly what we're, etc. So that's for us what's working. But I must say it keeps a challenge. And they always say like the social map, how do you keep that updated? We work mostly, if we do provide things on the internet, with websites of the organization. So if something needs to be updated, they need to do it themselves. So
yeah,
so far so
and
good.
I think, yeah, here in Belgium we also have to take into account the GDPR, the European guidelines on privacy. So it's not always possible to share everything. Yeah. When it's our personal details. So that's still a problem here in Belgium, because the electronic patient map file is well used in for GPs. I think it's really well developed for GPs, but the other professions, I know that the nurses and the physiotherapists have it. They have it. Sorry, but they don't share information within those files. Yes.
Yeah. There's
so
a
that's
lot
still
of
challenge
developments and challenges to go. But within this electronic patient map, we have now this portals where also information can be exchanged around people. So, and your other question about health literacy, yeah, I totally agree. We do have specific, also for positive health. I showed you the previous time. There is an we call this the simple version, where it's not with all the letters, but it's like spoken, and they only have to answer yes or no. And we also have in our training, I can show you shortly our website. Maybe I'm not sure if you know it. Let me see. Can you see the website of IPH? So this is,
yes.
Yeah, this is Dutch version.
Yeah.
I'll show you for the Dutch version, and then later I'll do the international. So if you go to downloaden, then you also have all the adult version, the younger version, children version. And here you have the simple version. And then if you can also print this out, and people have a conversation, for instance, with someone who supports them. But you can also, there's also like a digital one. Let me see, where is it? When you say, okay, you want to start the conversation, well, there's a lot of things you can see. But then there is a digital one, and then it's just with questions. Actually, now I show this to you, and if you're health literate, you can already not find what I wanted to show you, but I'll show you in 1 second. And this is the English.
No problem.
Yeah,
I found it already. So.
Oh, okay, yeah. The English version for our international colleagues, and then with Participate, you can also find the free downloads, and then at least you have also the Spiderweb, and this is the English, and here's the German just added. There's also a French one, Icelandic, and more are coming. And if you go in Dutch, then to the digital version, Mijn Positieve Gezondheid. .nl. I think then you get to the, so this is what the site I always give. This is then the eenvoudige, or the simple version. And then they get, well, you have to register, but then you get into the, how do I say, the explanation of yes and no, and with emoticons. For the children, they work with emoticons. They have to give if they satisfied or not. So this is the way how you can find some information. I had a few more slides. I don't know, Regine, are you still there? Or do you have any questions or feedback? Regine Born. Otherwise, we'll just continue.
May I also give some information while you're looking for the files? You were talking about an instrument that OTs are using. I think it's the Canadian Occupational Performance Measure. And maybe if it's fine for you, in a few minutes, or Klaus, you can also add information. I can explain how we do it. Very fast, very quickly.
Yes, it's nice if you can explain. Yeah.
Okay. Yeah. So we are asking our client to describe a whole day from the morning when he is still laying down in bed till the evening when he goes to sleep, and maybe during the night he also can give us some information. And we ask him what he is doing during a normal day, a general day, and ask also what he experienced as maybe a problem. So we make notes and we write down all the problems, and then after his story that we was telling us, we ask him if what we wrote down were really the problems. Maybe he can add some things, or maybe we did write down some things that are not really a problem. And then we ask how satisfied he is. We must just see how I translate it in English, how he finds that he is doing it at this moment. So we ask for his performance. We ask also how happy how important it is for him. And we ask how satisfied he is with it. And we ask him, if possible, to mark it on a Likert scale, a visual analog scale, I think you say, from 0 to 10, or we use other tools. And if a person says that a certain activity is really very important for him, and let's say that the performance is medium, the moment that we can, and he's really unhappy with this, not satisfied, the moment that we can improve the performance a little bit, his satisfaction might grow much more. And these are also things we take into account. If we do not know that person that well, if we first can work on the things that where his satisfaction grows a lot, maybe we assume that there will be more trust. And so we can build on a trusting relationship by watching what is his priority and looking. So yeah, you understand. I won't tell it in detail. So this was just the information about the Canadian Occupational Performance Measure. Klaus, if you want to add things, you can still add things.
Go ahead.
I think it was perfectly described.
And these things can add upon each other, so they can really strengthen each other, the different ways of working. So what I feel, as you just said, as a professional, you're also as an instrument yourself. You depending on who you have in front of you, one time you use this one time I use the other tool, and it helps to see what is needed for the other to help them one step forward, and what can they do themselves. Yeah, definitely. Thanks for sharing. I see Regine, do you want to reflect on what you heard, and do you have any questions, or what you need for your community?
I'm fine. So this is very good. Thank you. And I think I'm well informed.
Good. Yeah. All right. So what is your next step after you leave this meeting? What do you need?
I really don't know what I need, because I'm not in the field of the primary care itself. So as I said, I'm in the transition. So yeah, I was just curious how it could be if you work with it. So I'm here and I'm more than a listener than doing it in practice then.
Yeah. So it's different. You can do it in practice, but you can also, there's also HR managers who do it in an organization and say, okay, what do you need to have all your professionals being healthy, and have them reflect on their own health, and see what choices they can make to work more with more pleasure and with more vitality. But you can also do it like in the community and also in the policy. So there's different ways in education where you can apply this tool and this concept. So I see already that's almost 2 o'clock. So I have 2 more slides to finish it up. I had some more, but I'll go to these quicker. Let's see. So this is one more picture also how we use this in the community, like the people are central. It says neighbors, it should be people central. They have people around them, and sometimes they need social care, sometimes they need medical care, but it's all around the needs from the people themselves. And then I think it's really important with positive health that you have an resilience, to have a resilient and meaningful living, that you also need a supportive environment with some nudging. Well, you know, these kind of places where you try to nudge people to do the healthy things. And this is also what positive health is, to address what you can do or what you can do yourself. Well, we already discussed how can positive health support you, how can citizen empowerment be stimulated with the use of positive health. And what I think in my daily experience as a doctor is that asking people what's important and which steps they can take and which people they need or what they need to actually make the steps, it really empowers their own their own steps to actually get into action and take better care for themselves. So if you're curious and after this webinar you want to know more, I already showed you where you can find the free downloads. There's also information about online training. So we do an international training. Those are 4 sessions where you can really deepen in to exercise and start working with positive health. There's a handbook where there's a lot of things described. I also have a video, but I'm not going to show it now, but you can, we'll send you the information, the link, and then you can look it up yourself when you have time. So, well, I hope this was in a nutshell a little bit about community care and about positive health. I hope we had a nice conversation, and if we can, well, if you want, we can find each other and exchange maybe details about next steps you want to take. And I'm not sure if people want to exchange contact details. Christopher, the last words are for you. You can see, tell us what you can do from out of